When to book again? Well, after I start a baby, I definitely want to book a week after that new start, unless there's an acute injury or the baby is not nursing properly because they have to feed. So I might see them at the start of the week and the end of the week. Otherwise, I book the following week. I used to sometimes let it go thinking, oh, everything's fine. Don't do that. Have them back, reassess, look for more. If truly nothing is left to do, then let them go. Let's say it's follow-up number 1. You want to add another week in between just to check if another problem comes up, and I'll tell you why in a second. So wait 2 weeks and see them again. Now, if that span of 2 weeks lands you close to one of the growth spurts, which is 2 months, 4 months, 6 months, 9 or 12, but I'm going to focus in on the 2, 4, 6 because those are closer together. Try to time it for closer to that growth spurt. If you want to be seriously in a baby's life, you have to follow them through at least to the 6-month growth spurt. I shouldn't say have to, but I like to, because you don't see small restrictions on a small being. They need time to grow. There have been babies that I wish I had seen sooner, saw them when they were very little. Parents brought them back and said, my baby has this flat spot. It started about 2 months ago. And I was, disappointed myself for not having checked them at some growth spurts, because it's the time to catch the beginnings of positional plagiocephaly or other little things, right? Because the milestones are changing. They're getting different motor skills, motor abilities, and you want to make sure that they can do those motor abilities. So book them in for 2, 4, 6. That would be nice, and discuss it a bit with the parents. Sometimes they're like, no, I'm okay. Well, can we at least see them at the 4 month instead of like, we can skip the 2 months, something like that. Just try to make a bargain, try to see them 1 more time, 2 more times. Book children again, babies again, when there's chronic things like plagiocephaly or some other things, definitely at those growth spurts that I talked about. But with some things, you might even want to see them a month in between. So don't let more than 1 month go by. It's like, if you take a deflated balloon and draw a tiny little letter A on that and then blow it up, you're going to see the A a lot more when it's bigger. So that's the analogy I give to parents. And that's why I really like to, impress upon them that I would just love to see them then if they wouldn't mind.